Welcome to the Johns Hopkins Women's Health Podcast, A Woman's Journey, Insights That Matter. I'm Kelly Gear-Ripken, and I invite you to listen to Johns Hopkins specialists discuss the latest topics in women's health. Now here's your host, Lily Shockney.
Hi, this is Lily Shockney from A Woman's Journey at Johns Hopkins, and this is our podcast, Insights That Matter. In this podcast, I'm joined by Johns Hopkins clinical dietitian Jacqueline Rose to discuss plant-based diets. Medicine is concerned with advancing effective methods to treat existing disease, but also being proactive to prevent diseases. And there's new evidence that is emerging about the value of a plant-based diet in preventing disease and enhancing well-being. So welcome, Jackie, and thank you for joining us today.
I am so happy to be here. Thank you for having me.
For those of us unfamiliar with a plant-based diet, please explain where the name came from and what may be included in a plant-based diet.
The term plant-based actually was created in the 1980s by a biochemist. His name was Thomas Colin Campbell. And originally, plant-based was meant to describe a non-animal way of eating. So it did not include animal products in the diet. Now, it originally was associated with more vegan or vegetarian diet styles of eating. But more recently, it has started to encompass other styles of eating that may or may not necessarily include animal products. For those who aren't aware what plant-based foods are, they include essentially all fruits, vegetables, whole grains, nuts, seeds, beans, and legumes. Essentially anything that does not come from an animal is considered a plant-based food source.
When you say animal, are you including fish, for example? Sometimes people think animal means beef.
Yes, so that includes any poultry, fish, beef, pork, eggs, and dairy products.
So that's an important mention. So it also includes the byproduct, shall we say, of animals, which is the case with milk and other milk products.
Yep, exactly.
Very important to know. So increasingly, individuals like myself are concerned about growing older in the best health possible in order to preserve our quality of life as we do age. Is there evidence proving the advantages of a plant-based food diet for older individuals? And is it ever too late to start one?
There is quite a significant amount of research on the benefit for overall reduction in chronic diseases, diabetes, cardiovascular disease, cancer as well. Preventing some of those diseases can increase quality of life in older age. There also is a growing body of evidence that suggests that there may be a relationship between diet and Alzheimer's dementia or Alzheimer's disease. There is research that suggests that a plant-based or a more Mediterranean diet style of eating may lower the risk of Alzheimer's and slow the rate of cognitive decline. And for those who are not aware, I do want to mention Mediterranean diet and DASH diet. They are plant-heavy diets that do incorporate some aspects of animal proteins as well.
Which country would you say is practicing this the most? And how do we compare in the United States to those countries? You mentioned Mediterranean, which obviously is in the Mediterranean.
Yeah, so there has been, I'm sure a lot of folks are aware of the blue zones, Okinawa, Japan. There's a region in Italy, even the Seventh Adventists, which I believe are out of California. So those are considered blue zones. Those areas of the countries have been looked at for longevity, and diet is a component of that they look at. So a lot of those populations do have a more plant-based style of eating. Now, there are variations among those diets. Some have more plant-based styles of eating, some incorporate more animal products. How it compares to the general population as a whole, I don't actually have a statistic on that, but there are more individual populations that have been shown that eating in this way can promote longevity, if you will, among other factors.
Do you think that it is primarily the meat we eat that may be tied to various chronic diseases? Or could it also be those side dishes we add? Like, for example, I'll play the devil's advocate and say, potato chips, that's not from an animal, so let's have a bag of them.
Right. It does not necessarily mean animal products are all to blame. Traditionally, what we look at is sodium, which, like you mentioned, is found quite frequently in potato chips, sugar as well, sugar sweetened beverages, sugar that we have in certain foods or sauces, side dishes, if you will, and saturated fat that can come from higher fat meat products. And that's kind of why meat gets a bad name, is because certain meat does contain higher levels of saturated fat than plant-based sources.
One of the things I worry about with animals is what they eat. What are they fed, including hormones to chickens to plump them up? And there have been some studies done, but there certainly do need to be more to see if there's a correlation between, for example, increased incidence of breast cancer and the hormone levels that are in chickens. When you look at a package of chicken in the grocery store, it doesn't say this chicken ate so much hormone or to give us a percentage of his body weight, right? That contain hormonal factors. And yet we know that that certainly does happen. We also know that there are concerns about the use of insecticides with plants. Can you talk a little bit about that? And if someone was going to start, if their New Year's resolution for 2023 might be to start a healthier diet, and they say that 70% of people do exactly that on New Year's Eve. They say, I'm going to lose weight and I'm going to eat a more healthy diet, and it lasts until about the middle of February, and being trapped in the house with a snowstorm turns them towards other things in their freezer and cabinet, like those potato chips. But certainly insecticides is something that we need to pay attention to. Do you recommend, when we are looking at, let's say, eating vegetables, that they be organic? And how can we determine if they really are? Because the package might say it, but how do I know that's true?
It's a great question. It's something that does come up quite frequently. And I agree with you. You previously stated more research just needs to be done in order for me to really have a strict guideline or recommendation for a lot of patients, clients, and just general population. Now, organic is a pretty regulated term. You can't just slap on organic to anything. It's actually a pretty strict guideline in order to be organic. There are a series of processes and certain chemical byproducts that they cannot use in order to label something as organic. So if it says organic, it is likely organic. Now, in terms of whether someone purchases organic, really, as a dietitian, my role is to teach overall health and nutrition. When we get into organic versus not organic, I also really have to think about the cost for the majority of populations as well. So organic, if it's accessible, great. You may reduce some herbicides and insecticides that would be going into that product. But for the general population, because we really don't have any current recommendations or strict guidelines to recommend against them, and we know sometimes organic can be a little bit more expensive, I usually recommend, as long as you're getting nutritionally dense foods and nutritious foods in your diet. That's more what I'm concerned with over whether it's organic or conventional. At the end of the day, I want you to wash your fruits and vegetables regardless. But in terms of whether I prefer one or the other, just as long as it's a nutritionally dense food, that's what I'm concerned with.
Okay. And let's say some of our listeners are in their early 70s and they don't have diabetes, or they're not aware that they have or do not have heart disease or some other chronic illness, that the timing when people are in their early 70s is oftentimes when those types of chronic illnesses start creeping up. Mm-hmm. If they decided, I am going to adopt a plant-based diet, will it help to, I'm going to say, undo the damage of 70 years of eating other things?
I think it is beneficial to incorporate more fruits and vegetables, a plant-based style of eating, no matter what age you are. It can help for just overall weight management, which we know can progress into certain disease states or chronic diseases. It might increase your energy levels as well. If you have elevated blood pressure, it might help with blood pressure. So there are other benefits besides chronic disease prevention. Even if it means it helps you to get out and exercise a little bit more, if it makes you feel good physically and mentally, then those certainly are wonderful benefits to start incorporating a more plant-based diet.
Oftentimes, a patient's primary care provider will focus more on a low-fat diet, 30 grams or less of fat in a daily diet, but not mention the things that you're mentioning. I'm going to assume that that is not as healthy. as a stricter plant-based diet?
There's nothing wrong with necessarily a low-fat diet. It just depends on what you're replacing those low-fat products with. The reason why a plant-based diet is more preferred, or I shouldn't even say plant-based diet, a more emphasis or plant-forward style of eating that incorporates more fruits and vegetables and whole grains. The reason why we really promote that, especially as dietitians, is because of the fiber content. So we do look at fat, but fat does not necessarily mean bad, right? So there's heart-healthy fats, there's omega-3s that are found in a variety of different foods that we don't necessarily consider to be quote unquote unhealthy.
Right, like fish. Mm-hmm.
Exactly. Fish, avocado, nuts, seeds, flaxseed. Those are all foods that I encourage folks to have as part of their diet because they can help you to feel full and satisfied with your meals. What I really want to focus on is more fiber because fiber can help to increase your satiety at meals. It's higher in vitamins and minerals. Also, naturally, a lot of fiber containing foods like fruits and vegetables tend to be much lower in calories than other food products. So as a diet as a whole, if you're focusing on more fruits and vegetables, that can naturally help with weight maintenance and weight loss over time.
Can you explain to us the difference between a vegan diet and a vegetarian diet? They sound so similar.
They do, but they are actually quite different. A vegan diet is entirely plant-based, so it excludes all meat, all fish, dairy, eggs, all animal products, and byproducts. So many vegans may actually not incorporate honey because honey is an animal byproduct, gelatin, which is an animal byproduct, it's a pork byproduct. So vegan definitely is a little bit more strict in terms of the foods that are included into that diet. It's usually no animal products whatsoever. Now, a vegetarian diet tends to have more, I would say, flexibility. Some vegetarians may opt to include eggs or dairy. Some vegetarians also incorporate fish. There are different types of vegetarian styles of eating. Usually it's more like poultry, beef, and pork that are excluded. And then there's a variation in other animal-based foods or animal byproducts that would be included.
Do you recommend if someone wants to make this type of a transition from their current diet that's maybe heavy in animal over to a plant-based, should they go, I don't mean to make a pun, but cold turkey? Or is it better to slowly transition over, maybe even keeping a log of this is what I ate today and tomorrow this is what I'm going to add, this is what I'm going to subtract? It seems like it would be hard to not eat a hamburger right from the start.
I recommend doing it slowly, actually experimenting with different recipes, maybe different plant-based sources. So maybe you start with one meal out of the week, right? And you make it a plant-based source of protein. Maybe that means it's tofu or it's beans or it's lentils, trying to incorporate at least one plant-based source and then seeing if you like it, seeing if you actually enjoy those foods, seeing if you like preparing that or cooking those foods, seeing if they settle well in your GI system, because we know increasing fiber dramatically can actually cause some GI distress and cause some bloating. So I do recommend doing it kind of slowly, trying different foods, trying different plant-based proteins that you can incorporate into your meals. And also it makes it a little bit more sustainable. It helps build that habit of incorporating more plant-based proteins as opposed to animal-based protein.
You made a good point that it may trigger some activities of the GI tract, and it's good for people to know that up front so that they don't abandon their good intentions too early, thinking, well, I can't switch to this kind of a diet. I'll have to know where every bathroom is in town. But that does make sense to me of doing this as a gradual transition. And I like the idea of starting off with one meal a week and progress from there. Many of the individuals listening to us today are female and are the primary food preparers and grocery shoppers in their home. So it's usually not very doable for her to say, I'm going to go plant-based, when perhaps her spouse and teenagers are saying, I'm not going with you. I want to emphasize to the gals out there, that doesn't mean that you don't do the right thing for you. That when you're grocery shopping, you can be a little selfish and say, I'm putting these things in here for me, and I know nobody else is going to eat them. You just have to figure out your portion quality so that you don't go to Sam's Club and buy 5 pounds of broccoli if the rest of the family is not going to partake of that, for example, because I'm believe it or not, wasting food either. Is there a difference in the value of the foods that we eat comparing fresh food to frozen food?
In terms of nutritional value, there's really no significant difference in fresh versus frozen foods. I actually am constantly recommending frozen vegetables. They're a great way to reduce food waste. They save time when preparing meals. Sometimes they can be just very quick and convenient, and you're still getting the same amount of nutrition as you would just a fresh product. So really, there's no differences in nutritional value there.
That's good to know. Tell me about food preparation. I've heard before that, and I'll go back to broccoli. If you cook broccoli until it's so limp and has lost its color that it may lose some of its nutritional value, some of those vitamins are now in the water, in the steam, and no longer in that plant. Oftentimes, if we go to a restaurant, we may find that the vegetables are a little crunchier, a little firmer. And some people say, oh, gee, they didn't cook this long enough. And they probably did cook it long enough. Their intent was to maintain, right, that nutritional value for us. If you were going to fix broccoli for dinner today and put it in a steamer pot, how long would be the right length of time to cook something? Because I know my friends oftentimes will cook it for 20 minutes or longer. And I'm like, there go the vitamins, unless I'm going to drink that liquid.
Yeah.
Pours it down the sink.
It does, to some extent, come down to preference. Some people just really like soft broccoli, if you will. You're absolutely right in that you'll probably lose less of the vitamins and minerals in that broccoli by cooking it for a shorter amount of time. What I recommend is really having variety in your cooking methods and in how you're eating your vegetables. Heating sometimes affects the vitamins and minerals. It can destroy them to some extent, not completely, but to some extent. So having variety in the different types of vegetables that you consume and also balancing fresh versus cooked vegetables. That's the best way to maintain the vitamins and minerals in there and also to get a variety of vitamins and minerals as well.
Got it. Okay. As a breast cancer survivor and a patient advocate, I know that there have been some studies done that raise the question of soy products for breast cancer survivors. Some of the studies I'm familiar with, however, have shown that there's a good possibility that soy may be of benefit. We do know that Asian women have the lowest incidence of breast cancer in the world unless they move here to the United States and adopt our Western diet. And then their risk goes up to 1 in 8, whereas if they were still in Asia and still eating their very heavy soy diet, their risk is 1 in 22. So though, let's say tofu contains estrogen, it actually, from the studies that I've seen done, they are phytoestrogens. And we actually like phytoestrogens. Some of the treatments that we give for breast cancer, for example, a drug called tamoxifen, a hormonal therapy, the opposite of hormone replacement therapy, the way it works and how it works is with the phytoestrogens that is in it. But I've also read that if we were going to eat soy and get the real benefit from it in reducing potentially breast cancer, being that 1 in 22, we would need to start eating it as a child. So if we're picking it up, let's say late in life, it may not have the same benefits from a breast cancer reduction perspective that it could have had we started when we were 3 or 4 years old. Have you read anything about that or have any comments about soy and its benefit? Or I do want to reduce the worry of our audience and not have them steering away from soy products, particularly when they are plant-based soy products. I'm not a fan of the soy products that are in, let's say, pill form or powder form, where you're going to mix it in a drink, because I'm going to make another pun. That's a different animal.
So it's a concern we hear very frequently with a lot of our patients, a lot of our women in particular, and in our oncology setting. Now, cancer organizations like the American Cancer Society, several major medical organizations, Sloan Kettering, MD Anderson, Dana-Farber, they all agree that soy products can be safely consumed by individuals with breast cancer and can be helpful for preventing or reducing breast cancer. I agree with you. Now, those individuals who are interested in consuming soy or want to reintroduce soy back into your diet, if you've been eliminating it, it's really about 2 servings a day of whole soy products. So that means tofu, tempeh, edamame, and soy milk. That's what we consider to be whole soy products. And I completely agree. Consumption of soy supplements is not currently recommended and not supported by research at this time. And that's just because we don't know the levels of isoflavones, which is in soy products, and whether or not they're safe to consume. We just don't have enough research for that right now. So the general recommendation is getting your soy from whole food sources, not really consuming soy supplements. Also, the whole soy food contains the vitamins and minerals and the fiber that is really benefiting you from that product.
And I'd like to comment again about broccoli. Dr. Paul Talalay at Johns Hopkins did 46 years of research on broccoli sprouts. Talk about stick-to-itiveness that man had in studying broccoli sprouts. And what he learned over those decades is that broccoli sprouts contain sulforaphane, which has been proven to stunt the growth of breast and colorectal cancer. What I found fascinating, and many years ago I visited his lab, was that if you let the broccoli grow to be, I'm going to call it adult broccoli, what we normally see in the stores, it has lost 91% of its sulforaphane concentration. You'd have to go to Sam's Club and eat the 5-pound bag of broccoli in order to get the benefit of 1 serving of the broccoli sprouts. He also went to some vitamin stores where they sold broccoli sprouts in capsules and took them back to the lab and tested them and found they were alfalfa sprouts ground up. So even though it says on the package it's this, it might not be, and all the more important of eating something fresh and not in a pill or capsule or powdered form for sure. But I was fascinated by that. And Johns Hopkins, under the direction of Dr. Talalay, actually created a product that's sold in various stores and online called Brassica tea. That is, I'm going to call it broccoli sprout tea, but it's Brassica tea. And I know a lot of breast cancer survivors have incorporated that into their diet for sure. I have read that many plant-based products are highly processed. Does that compromise its nutritional value?
Being highly processed does not necessarily equate to bad. Now, plant-based products, yes, there is a level of processing that you need to undergo in order to turn a bean into a burger. So there is a level of processing that occurs there. Now, in terms of convenience, in terms of some nutritional value, plant-based products like a meat analog, so like a plant-based burger or a plant-based sausage patty, if you will, it does have a lot of fiber and it does have quite a bit of protein. They also fortify it with B vitamins. There's iron in it. There's usually B12, which is really important for a very plant-based style of eating. Now, when I'm doing counseling, a lot of times I do recommend them more in moderation, not so much for the nutrient levels, but more so for the sodium levels that we find in a lot of these products. So meat analogs just tend to have much higher sodium levels. It helps to preserve it. That's true of a lot of what we consider, quote unquote, processed products. They're much higher in sodium. They are also quite expensive as well. I would much prefer individuals to have them on a more moderate basis, having them kind of as a more once in a while, eat them in moderation kind of food. I would much prefer whole plant-based sources like tofu, edamame, beans, and lentils, as opposed to more processed plant-based meat analogs.
So many people are interested in the connection between their overall health and the microbiome. Does a diet rich in plants benefit the microbiome?
Yes. So diets rich in plants are much higher in fiber. And we know fiber is fermented by the gut microbiota, which can provide energy and substances for microbial growth, potentially increase diversity. It also helps to produce short-chain fatty acids in our gut. That's a really important component of plant-based foods, is that fiber helps to produce those short-chain fatty acids in the gut, which can enhance delivery of nutrients. It can help to maintain the integrity of the colon in particular, and it could potentially stimulate the immune system. Now, in terms of what that means for chronic diseases and other health outcomes, research is still being conducted in that area. So we're still learning how it really impacts chronic diseases and disease prevention.
Do you recommend that a patient, before they embark on a plant-based diet, sit down with a dietitian to discuss this transitional process? And I would also hope it would include taking a look at the medications that he or she might be on, including supplements and herbs before they get underway. I can certainly picture some people not understanding that making this kind of a switch, though a very healthy choice, could cause some things to stir up. And we don't want anybody having diarrhea, for example. They may be already taking some probiotic or who knows what, not realizing that putting these two things together, because they aren't thinking of this as something that's going to cause a change in their GI tract, could really, the storm is coming, right? Oh boy.
Absolutely. I absolutely recommend that if anyone is thinking about transitioning to a more plant-based style of eating, or even going further to a more vegetarian or vegan diet, I do recommend speaking with a dietitian, because we look at other factors. So what chronic diseases do you currently have? So for example, certain stages of chronic kidney disease, you do have to be very monitored by a dietitian in terms of the foods that you're eating, because a lot of vegetable sources and a lot of fruit sources are high in potassium, which could elevate levels for someone with chronic kidney disease. So we definitely monitor that. Another example is someone with an active IBD flare, so Crohn's or ulcerative colitis. A plant-based diet might just not be appropriate at that time. It's something that you can work with a dietitian with down the road. But if you're experiencing malabsorption or severe diarrhea with that chronic disease state, you do want to work with a dietitian to make sure you're not losing weight or you're not at risk for what we call malnutrition. Another example would be someone like an oncology patient. If you are having chemotherapy or radiation in the abdominal region that's promoting a lot of diarrhea, a plant-based diet just might not be right for you at that time. So working with a dietitian is going to be really important, so we can look at where you're at, what your current symptoms are, and then what the most appropriate diet would be for you at that time.
I think that people diagnosed with cancer or with another life-threatening condition, they suddenly get what I call foxhole religion. And they want to do everything and anything that is going to improve their health and reduce their risk of getting cancer again, or whatever disease that they have of it getting progressively worse, without thinking through, let's do this as a transition and not this stop today and start something else tomorrow. And certainly for those that are receiving chemotherapy, we want to make sure that they aren't getting dehydrated. If they've made a decision, well, I'm just not going to eat except one piece of tofu a day or something. And believe me, I've taken care of patients that have gone this route of a dramatic switch. And I always say, do things in small increments. That's when we're successful. This stop today and start something else tomorrow could be actually detrimental, including medications that we are having them take. If they end up with diarrhea, then those medications are not being properly metabolized, right? They're just mainlining right on through their body. And that truly can be more harm than good, for sure. If someone is looking for more information, can you recommend websites and organizations where they can find information about plant-based diets and how to get started?
I really like the Academy of Nutrition Dietetics. They're eatright.org. They have excellent resources for how to start, a more plant-based diet, how to build a plate, choose my plate. So the USDA's website also has recommendations on how to structure your plate for plant-based diet or plant-based recipes. And actually, the American Heart Association is one of my favorite resources for just recipes in general and for resources. They have excellent cooking tips, how to cook certain foods and how to incorporate some of these foods into your diet. So they're a great resource. Now, for individuals who are listening who might have chronic kidney disease, I do recommend the National Kidney Foundation, so kidney.org. They do have resources for you on that website on how to do a plant-based diet with chronic kidney disease. I still recommend speaking with a dietitian, but they are a really excellent resource for that. For someone who does want to pursue a plant-based diet with CKD.
For those with children and grandchildren, how young is it okay to start a child on a plant-based diet?
Children can be on a plant-based diet in a healthful way. I do recommend working with a dietitian, though, for children who are on a vegetarian or vegan diet and close monitoring with a pediatrician, just to ensure that that child is getting the vitamins and the minerals they need, and also the other macronutrients like fat sources and carbohydrates for proper growth and development. There's really no age that they can start. They can start at any time, but it really should be monitored closely by a pediatrician and also a registered dietitian.
Very good. Those are very good points. How about if someone listening to this podcast is interested in making an appointment with a clinical dietitian at Johns Hopkins? How would they go about doing that?
We are a referral-based service. We do have a nutrition clinic within the Johns Hopkins Hospital. We can see primarily anyone in this clinic, and we also have several dietitians in other areas that we can refer you to. If we don't think that our clinic can assist you, we have other dietitians in certain areas that can help you as well. In order to schedule an appointment with a dietitian, we would need an ambulatory referral to nutrition within the Hopkins system, or your doctor can fax that over to us. We do have a number that you can call as well. 410-955-6716. That is the Johns Hopkins Nutrition Clinic. Now, if you go to any other hospitals within the Johns Hopkins medicine system, so Bayview, Sibley, any hospital within the Johns Hopkins system, just go on the clinical nutrition website through Johns Hopkins, so Johns Hopkins Clinical Nutrition. We have all of our outpatient clinics listed on there and the numbers for all of those clinics that you can call. So you don't necessarily have to come all the way down to the main hospital. We do have dietitians in other areas as well. If you are in our oncology setting, so if you are through Vera or are currently on active chemo or radiation, I do encourage you to ask your doctor for a referral. There are dietitians within those areas at Johns Hopkins and Bayview in particular, and I believe also at Sibley, who can assist you and counsel you in those areas as well.
Very good. Very good. First of all, Jackie, I want to thank you for doing a thorough job and enlightening us about the value of plant-based diets, that it's never too late.
It's definitely not.
Thank you for joining us today to learn more about plant-based diets, and Jackie, for taking your time out of your schedule to educate us on really the power of nutrition in preventing disease and getting some diseases into control. We hope you will join us next month for another educational podcast featuring another Johns Hopkins medicine expert. In the meantime, I invite you to visit the A Woman's Journey website at johnshopkinsmedicine.org/A Woman's Journey to sign up for our monthly e-letter, read about the upcoming podcasts and programs, and to sign up for our upcoming free Conversations That Matter webcasts. Again, Jackie, thank you.
Thank you for listening to A Woman's Journey podcast. Join me, Kelly Gear-Ripken, your host, Lily Shockney, and a variety of Johns Hopkins experts on the first Thursday of each month to learn about medical advances in women's health. A Woman's Journey is grateful for the unrestricted educational grants from HRH Foundation that supports our podcast series, Insights That Matter. For more information about A Woman's Journey's virtual programs occurring throughout the year and our monthly webcasts and podcasts, visit our website, hopkinsmedicine.org/A Woman's Journey. Like us on Facebook and Twitter, and visit our website at hopkinsmedicine.org/A Woman's Journey. Until next time, stay well.